Hi, I'm Ava. I'm 17 years old and I'm from Connecticut. I'm going to be a senior in high school this year, and this is my journey with scoliosis. So I was first diagnosed with scoliosis at 9 years old. I was going to my physical, and my doctor noticed that my back was a little bit uneven, or like my shoulders were uneven. She sent me to get like an x-ray done, and that's when we realized I had a very mild case of scoliosis. So she told us that there's a chance it will progress, or there's a chance that it might not progress. And since it was so mild, we didn't really do anything. But then 2 years later, my scoliosis progressed and I was prescribed to get a back brace. So I remember being in the doctor's office and there were two options. There was a night brace I could wear or a day brace. So the day brace option was like for 18 hours a day. And immediately, like when I saw what the braces looked like, I was very intimidated. They were very bulky, large, and a lot of the patterns on them were super unflattering and loud. And I was entering my first year of middle school. So I was really afraid of having to wear one of these braces. So because of that, I went with the night brace option, and the efficiency rate was a little bit lower, but I was willing to take that risk because honestly, I did not want to wear a brace. But because of that, my scoliosis progressed a little bit more. And eventually the summer before my junior year, I was told I needed back surgery. Um, so I remember being super intimidated the night before my surgery. I was like super afraid. I've never had surgery before. I like didn't really know what it entailed, and I was super nervous. So here's a photo of me right before my surgery. And here's an x-ray of my spine after. And after I had the surgery, I was definitely really tired, but it was a lot like less intimidating than I thought it would be, because I was put in contact with a girl my age named Gabriella. She was also 16 or 17, and it was really helpful to talk to her. And I'm honestly so grateful that my doctor put me in contact with her because she really helped me with my journey. So I would say I was in the hospital for maybe 2 days. And then after that, I was able to go home, and obviously I didn't really have full range of motion. It was kind of hard to get up and down. But around 2 weeks later, I was like able to kind of go walking and like sit in restaurants. So my recovery was definitely a lot faster than I thought it would be. Something that really helped me during my surgery recovery was doing a lot of art pieces. I'm an artist. I've always loved doing art, but this was like something that really helped me because obviously I wasn't able to like go work out or anything. I kind of just had to spend a lot of time at home. So I spent a lot of my time painting and exploring different art mediums. And I actually recently launched a solo exhibition called 43 Degrees that communicates my journey with scoliosis and kind of promotes body positivity for other women suffering with this condition. So here are kind of some of my pieces that I worked on during my recovery. So here is me today. I think though this process was definitely really intimidating, I'm so glad I had the surgery, and I don't really think the surgery posed a lot of limitations for me today. So I love to do things like hang out with my friends, and here is actually a photo of me pitching my organization Embrace in an entrepreneurship competition. So I'm actually going to get a little bit into this. While I was also in recovery, I was a part of a support group called Curvy Girls. And a lot of young women were complaining about the back brace designs available and saying that the patterns were very loud, garish, and unflattering. And I definitely agreed with them because I remember when I was in the doctor's office looking at the brace patterns available, I did not want to wear any of them. So I decided to take a look at the brace patterns available on this website called Frittles, which is an orthopedic appliance company, and they manufacture a lot of braces. And immediately I, agreed. All the designs were super unflattering. So I decided to call the orthopedic company and ask them who was creating the designs. And that's actually when I learned they didn't even have a pattern designer. So I offered to help them create some new designs. And I thought the best way to get other people involved with this project was to host a competition. So in the beginning of this year, I launched Embrace, which is a nationwide pattern design competition. And basically, artists across the country, or essentially anyone, can submit a pattern design. And winning pattern designs would be transferred onto the surface of back braces and judged by women with scoliosis or women in the scoliosis community. The competition went really well. I will probably get into that at the end of my story, but this is just a photo of me pitching it. And I actually won first place at the competition, which was super cool. And here's just a photo of me with my sister's dog, Milo. Before I ended this, I just wanted to thank Setting Scoliosis Straight, because they're an amazing organization and they've really helped me a lot with all of my projects I want to do. And they're also such an amazing resource for any patient suffering with this condition. And I really wish I knew about this earlier, because I think this honestly would have helped me a lot more during my journey with scoliosis. But they're really amazing. They helped sponsor my art gallery exhibit. And they also helped me with Embrace. And I'm just so thankful that they were willing to take me on and willing to help me. It's just been so amazing working with them. So yeah, that's my story.
Hi, I'm Catherine. I'm from Pennsylvania, and I was diagnosed with scoliosis when I was in sixth grade, and I wore a brace for 2 years, about 22 hours a day. And so my first question for Ava is, what piece of advice would you give to young girls with scoliosis to help them be more confident in wearing a brace or having a surgery scar?
Yeah, so this is a really great question. I remember I definitely struggled with confidence when I was first getting braids, and also after my surgery, I was really, not feeling super confident about my scar. So my advice for young women suffering, with this is that when you wear a brace, I always thought like, oh, everyone's gonna like judge me, everyone's like noticing me, everyone's like looking at me. But like in reality, everyone's like so focused on themselves, and no one's gonna judge you for wearing a brace because you're treating your condition. So that's my advice. It's definitely not as big as you think it is. No one's looking at you, no one's judging you. That's something that is just personal, and it obviously feels a lot bigger to you in the moment, but it really isn't. And then as for the scar, so this is something I'm honestly still working on today. I'm still not like 100% confident with my scar, but I'm definitely getting there slowly. And honestly, I don't think there's like a specific like secret that's going to make you super confident overnight. But what I started doing is I just started like showing my scar off. And for prom this year, I wore like a low back dress, and I've just been trying to like show it off more. And I think it's kind of something where it's like, the more I do it, the more confident I'm starting to feel with it. So yeah, that's my advice.
Yeah, that's amazing. And then my second question is, you mentioned a compelling intersection of body positivity and scoliosis that you're addressing in your art exhibit. Can you discuss this relationship further and how it inspired your art?
Yes, totally. So I love art because I feel like it can kind of communicate a message in the way that words can't sometimes. And I wanted to have this art exhibition because I wanted to show the challenges with body positivity in my art, but I also wanted to show the positives and how you can kind of take this negative feeling and really just embrace it. Um, so there's like one piece where it's a girl and she's wearing like a prom dress and it's low back, which is like my story. And she's just kind of letting her scars show. And I think through my art, I can kind of show, I'm almost like normalizing, having a scar, having like a crooked back and like feeling okay with it. So that's kind of what I tried to show through my art in the way that words can't.
Thank you for answering our questions. And then, yeah, we'll pass it to Michelle.
Yeah, hi, my name's Michelle, and I'm also from Pennsylvania. And this year I'm going to be an incoming junior. And I was diagnosed with scoliosis when I was in seventh grade. And I also wore a Wilmington brace for about a year and a half. And fortunately, my curve was stabilized at around 35 degrees, so I didn't have to undergo surgery. So, Ava, my first question for you is if you could elaborate a little bit more about how Gabriella was able to help you through your journey and what kind of role did she play during that time?
Yes. So I was really nervous before getting the surgery. So I set up a phone call with her and I also texted her and I kind of expressed a lot of my concerns that I had with the surgery. And she was able to answer all of my questions. She talked me through exactly what she went through. And honestly, it was just so nice to be able to speak to someone my age because at that time I didn't really know anyone else with scoliosis. And yes, I had my doctor, but obviously, he wasn't the most relatable person. So it was so nice being able to speak with her. And something that she really helped me with was confidence. I remember I was really nervous about what my scar would look like before surgery. And she was telling me about like all her scar tips, this tape she used. She even offered to send me photos of her scar. And she's so kind, and that really helped me a lot. So I still talk to her to this day. So yeah, she really just eased a lot of my stress about the surgery.
Yeah, that's really awesome.
Yeah.
My second question for you is can you tell me a little bit more about Embrace and if it's like a more ongoing competition or if it was a one-time event?
Yeah. So I touched on this a little bit in my PowerPoint, but Embrace is a nationwide pattern design competition in which anyone can submit a pattern design that they think would be fashionable for the surface of a back brace. And then women with scoliosis or women in the scoliosis community help pick out the winning designs. Um, so, and also the winning designs will actually be printed onto back braces for the company Frittles. Um, so I launched the competition in February and we ended at the end of March. So the first round of Embrace is finished, but I'm actually thinking of launching the competition again later in the year. And I'm actually thinking of doing like a fashion competition where anyone can submit different like fashion clothing items that can accommodate and disguise a back brace. So that's still up and coming, but yes, I hope to continue Embrace, you know, longer. So yes. Thank
Yeah, that just sounds wonderful.
you.
Yeah, that's all the questions I have, so I'm gonna pass it on to Diana.
Hi, my name is Deanna. I'm 16 years old. I am currently an incoming senior, and I underwent about 4 years, 5 years of bracing, and then unfortunately I had to do the spinal fusion. And first of all, I really want to say I'm very inspired by your story, and I really love the fact that you used art, that is your passion, to help others. That honestly, I found it personally very inspiring. And so from there, what were the two things that helped you the most after spinal surgery? I presume it's art, one of them, but I still want to hear what you say.
Yes. I touched on this. So yes, art is one of them that helped me so much doing it. And I recommend like, even if you're not like an artist, just doing a hobby or something that you love during your surgery can really help. I mean, I know not everyone can do like a sport or something, but just something even small. Like I know a girl who even started doing crocheting during her surgery. So just doing something small that can help you pass the time is something I recommend to patients. So art. And then also my mom bought this like foam wedge pillow that was super comfortable. And I actually love that pillow. So that helped me so much. Because obviously I was in a lot of pain, but like, yeah, I will try to see if I can find the link somewhere and maybe like send it. But yeah, that was definitely the two things that helped me the most.
That's great. That's great. And my second question for you is, do you feel more confident now that you had the surgery, and why?
Mhm. I would definitely say I feel a lot more confident. So obviously there's like the cosmetic reason, like my spine is a lot more straight. So I do feel a lot more confident, like, in terms of appearance. But also before I had the surgery, I was really stressed a lot of the time because I didn't know if my scoliosis was going to progress further. And it was just kind of something that was super uncertain. So once I had the surgery, like I know for sure we stopped the curve and I know it's not going to progress anymore. And just honestly, that is like such like an ease, like that just brings a lot of comfort just to know that. So yes, I am definitely a lot more confident after having the surgery.
That is great. Thank you so much, Ava, for sharing your story. It was
Thank
very nice.
you. Thank you so much, Diana, Michelle, and Catherine, for asking questions today. I'm so glad to share my story with everyone. So yeah, bye.